Your spinal discs are like shock absorbers between the vertebrae of your spine. They help your back stay flexible, but as you get older, they can show signs of wear and tear and really cause pain. Let's talk about it with Dr. John Liu and Dr. Patrick Shea, neurosurgeons at Keck Medicine of USC, affiliated with Ridgecrest Regional Hospital. This is Health Matters, the podcast from Ridgecrest Regional Hospital. I'm Prakash Chandran. So, Dr. Liu, let's start with you. What exactly is degenerative disc disease?
Well, Prakash, this is a very common problem, as you described it in terms of a shock absorber. Right? It's kind of like the shock absorber in your car. After some wear and tear, that shock absorber can start to wear down, and that's kind of what the shock absorber, a disc is in your spine. Is the shock absorbers that's between the bones in your spine, and those are just with typical aging and just kind of daily wear and tear that we all put on our spines. Those discs undergo some degenerative changes, and most of the time it doesn't cause problems. But when it becomes problematic, meaning that it causes more pain for people and develop other symptoms, that's when we call it degenerative disc disease.
Understood. And Dr. Shea, I want to move over to you. What are some of the symptoms that people experience when they have degenerative disc disease? You know, Dr. Liu mentioned that there's some wear and tear over time, but when do we really know that it's getting bad and becoming this degenerative disc disease?
Sure. Thanks for the question. So I think that, in terms of the wear and tear of the disc spaces, it's really common with aging and just the duration of the mechanical stress. It really becomes more of a disease when patients are symptomatic, and usually the first primary symptom is pain. And your typical mechanical strain or early degenerative disc tears, the pain may only last for a couple of days or a couple of weeks at most, and they tend to get better because your body does have a self-healing process with the degenerative disc process. But it's really the patients that have chronic disabling pain that becomes more of a disease process. And not only is there pain in some cases, but there are patients who develop neurological manifestations of the degenerative disc disease that can include weakness, numbness, and loss of function as a result of the disturbances to the nerve roots or the spinal cord.
I just want to echo what Dr. Shea just said. I think, back pain in general is very common, right? So that we all get back pains. We did a little too much, lifted too much. And usually those are self-limiting, meaning that, within a couple of days or a few days, it typically gets better. What problem occurs when the times that you want to start thinking about calling your doctor is if the back pain kind of persists and it goes beyond a couple of weeks. And if that's the case, so typically, you may want to notify your primary care physician. The times that we get involved as specialists, of spine specialists, is when these pains are longer lasting than when it lasts like more than a few weeks, or if you start developing some leg pains or other neurological type of issues, and that's when we get involved.
So, Dr. Shea, I want to talk a little bit about the diagnosis process. And I think one thing that I've learned here is that, there's constant back pain. I just had back pain recently when I went to the gym, but yeah, you're right. It went away after like 2 weeks. But if it is persistent and it lasts around 3 weeks, and let's say I go into my doctor, Dr. Shea, talk a little bit about how it is diagnosed.
Absolutely. So, diagnosis of symptomatic degenerative disc disease generally starts with a physician's evaluation. And in most cases, I think the process starts with a primary care physician, but in some cases, it should start with someone who has a little more expertise in evaluation of spine condition. Now, in general, I think the pain symptoms can be separated into two parts or components of two parts. The most common symptom of degenerative disc disease is just back pain. It localizes to either the neck or the back. And as you said in your personal experience, that these generally are fairly self-limiting over days to weeks. Now, when symptoms of back pain are more than bearable, or if they last more than 6 weeks, I think that's really the first time that you should get an evaluation by a physician. But there are some red flag symptoms that you should seek a physician advice or consultation sooner, and typically those are the neurological symptoms, the symptoms that lead to weakness, numbness, and as I said earlier, the components of two sides of the pain is not just back pain. The other part of the pain is really what we call neurogenically related, and those are typically the pain symptoms that people describe as sciatica-like pain, where the pain shoots down an arm or legs from the pinch of the nerve from the degenerative disc disease. Now again, with pain alone, most of the time, you're probably pretty safe for about anywhere from 2 to 6 weeks, as long as it doesn't get worse and it's not associated with weakness or sensation loss.
And Dr. Liu, I'd love to learn a little bit more about the treatment options that are available. Let's say you go in and you have the evaluation and it is determined that you have something. Maybe talk a little bit first about any non-surgical treatment options, and then we'll move to the surgical ones.
Sure. So with treatment, we always start off with non-surgical. Very, very rarely do we actually recommend a surgery right up front. Usually those are for very special occasions when there's some severe nerve compression. But conservative treatment is the most likely is what we're going to do first. And when you see your primary care physician, they're likely going to talk to you and do an exam and do some basic imaging. And if the degenerative disc disease is what we think you have, then typically we'll start off with some anti-inflammatory medications. Sometimes if you have little spasms, we may try different medications, like try to cut those muscle spasms down. And then physical therapy, right? So those are your two most basic conservative approaches. It will be physical therapy to help you to kind of take care of some of the weakness that we all have in our backs, and we try to strengthen some of the muscles around the spine, and teach you about good posture control, and how do you bend and twist, and how do you live daily life without causing more problems with your back. So medication and physical therapy are the most common non-surgical options. And then another conservative treatments would be sometimes an injection may be indicated. Usually, I don't necessarily start that right off the bat. Usually, we'll try the medication and physical therapy first. And medication also includes sometimes we'll use some topical patches too. Some heat treatment, sometimes little massages, and some soft tissue work. So there's a lot of stuff that we can try in the beginning stages.
Okay, and just to elaborate a little bit more, maybe Dr. Shea, you can answer this. Let's say you try all of those things, you go to physical therapy, you take the medication, and it still doesn't seem to be fixing the problem. Talk a little bit about the surgical options that are available that you typically do to help, cure or minimize the pain of this degenerative disease.
Sure. So in general, most of the time, if symptoms last beyond 3 months while patients have exhausted all the conservative treatments that Dr. Liu had described, we can consider surgery in some situation, and it really has to do with whether or not the symptoms can be explained by what we see in terms of the patient's physical examination, as well as typically some type of advanced imaging like an MRI or a CT or CT monogram. And what we're looking for is a potential pain generator that can explain the patient's pain or injury that can be fixed with surgery. And generally, it has to do with either nerve compressions or mechanical instability of the spine. And typically, if we have mechanical compression of a degenerative disc disease, either from a disc herniation or from overgrowth of bone spurs and ligaments, what we do is a laminectomy or a discectomy, which is basically removing the portions of the disc or bone spur overgrowth that relieves pressure off the spine. And in cases where there are instability or mechanical disruption of the spine in terms of stability or alignment, then we may have to do something more complex like a spine fusion. So, there are a number of pathologies that we're looking for, but most of the time what we're looking for is some type of pain generator or disturbances that we can fix, if you will, or alter with surgical treatments.
I'd just like to add, in terms of additional, there are some alternative type of treatments even before surgical intervention that sometimes people will try and they may gain success. And the reason we say alternative is just because these are sometimes we don't really have a lot of medical evidence that may be effective, but people still try them, and sometimes really it's helpful. And a couple of these would be like acupuncture or chiropractor, and a lot of times people have success with their back pains with those modalities. And there are some clinical trials that may be going on. I know Dr. Shea is head of a couple of these clinical trials that's ongoing at USC. I don't know if Dr. Shea wants to make a comment about that.
Yeah, I think there are some innovative things that we're trying to do to repair and heal the disc. And a couple examples of some of these clinical trial investigative approaches are one which is actually a stem cell injection. For someone who has a single level disc disease that we can identify as the most likely source of potential pain generator, these are basically cells that have been harvested from the disc space itself that by our early investigation and research into the topic, that these stem cells should be able to implant it into the disc, and the hope is that these cells can actually help repair the environment of the disc and provide healing of the disc that's accelerated pace compared to the natural healing process. There is also a type of nerve ablation, if you will. It's ablation. Basically, it's applying thermal energy to a specific nerve that is sensing the pain from the vertebrae from the pathological process. And when you ablate and burn those nerves away, it can abate and subside the pain for patients who have symptomatic back pain. Those are just some examples of some of the clinical trials and investigative approaches into treatment of back pain besides the surgical treatments.
Wow, I really feel like we're living in the future here, hearing about some of these treatment options. So, Dr. Liu, in wrapping up here, I wanted to move it back to you. You know, you mentioned that in physical therapy, you have them focus on posture and, things like how to bend over properly. But I want to talk a little bit about prevention. So how can people think about preventing the onset or minimizing the severity of degenerative disc disease?
Yeah, that's a very good question. I think we all are going to get degenerative disc disease in some form. Hopefully, we can try to minimize the amount of symptom, right? So this is just part of aging. We all have it. Everybody's got it. And if I image everybody that comes to clinic, we all have some disc degeneration. But there are things you can do to try to slow down the process and hopefully never need an operation. And these would include the work on your core strengthening, and the physical therapist will teach you how to strengthen your core area. So you could be in great shape in terms of running and cardiovascular wise, you're doing great, but then your core could be weak. So do core exercises that helps you strengthen your core area. I think that's very important. Don't gain weight, right? So it's really stay within your ideal body weight. I think that's another a big piece in terms of how to prevent these from getting out of control. I think the more excess weight you carry, it will put more strain on your spine. Right? So try to lower that risk. Don't smoke. So if you're a smoker, you are at a higher risk of having more problems with degenerative disc disease, and because smoking can actually affect the blood flow to the disc itself, and so that can potentially be a significant factor in terms of having chronic back pain. And so those are kind of three things that I think we can all do for ourselves. Being careful with your posture, right? So everybody got bad posture, right? So learning what good posture is, how do you bend and twist? There's a good way to bend, there's a bad way to bend, right? So you're just trying to limit in terms of your risk for developing more problems in the future. So if you kind of keep those things in mind, smoking, your weight, your posture, and just try to maintain a good core, those are all good things to try to prevent this becoming out of control.
All right, Dr. Shea and Dr. Liu, really appreciate your time today. That's Dr. John Liu and Dr. Patrick Shea, neurosurgeons at Keck Medicine of USC, affiliated with Ridgecrest Regional Hospital. Thanks for checking out this episode of Health Matters. For more information, visit rrh.org/treatment-care/neurosurgery. If you found this podcast helpful, please share it on your social channels and be sure to check out the entire podcast library for topics of interest to you. Thanks, and we'll see you next time.